If you're calling in, can you please identify yourself?
If you're on the phone, if you could please let us know that you are on. Not necessary.
Jonathan Leonard with Jefferson Community Health Center.
Okay, good. We're going to call the...
Amy Brown with Wakert Realtors in Woodbridge. Can't get to the phone. Please leave a message and I will...
Can you hear me?
Yes.
I can't hear any of you.
Oh, no.
Oh, no.
Can you hear us now? Can you hear us now? Oh. Nancy, can you hear us?
I don't think so.
That has to be on her side because caller 5, Jonathan, was able to hear us.
Can folks let us know if they can hear us? Please, I know Nancy can't hear us right now.
Chad is able to. In the chat.
Nancy, are you hearing us now?
Oh, I said that to the host. I meant to set that to everybody.
So can you nod if you can hear me?
We can hear you,
Thanks, Francisco.
but you can't hear us.
No.
Okay. So Clint Coots.
Is there a number she can call?
Pardon me? Nancy, can you hear us now? Nope. Do we want to ask her to re...
Do we have a number?
Can you forward the call-in number with the access that goes to? Yes.
So let her know that we're going to give her a call-in number.
Nancy, we'll be sending you a call-in number.
Can you hear us? I don't think she can hear.
I wonder if everybody else can hear us.
Sounds like it. Do you want to go ahead and call the roll?
Paul, can you still hear us? Can you unmute Paul? One more time. Paul, can you still hear us?
Your call cannot be completed as dialed.
Did you send Nancy the info? Okay. So we are having some technical difficulties. Please hang on, and we will be calling the meeting to order shortly. So Clint Kuntz is saying that he can hear, but he can't unmute.
Yeah, because they're attendees, unless you want me to make it panelists and then they can unmute themselves.
Make all the task force members panelists,
Nancy, can
please.
you... Okay,
Other folks can hear.
okay, just want to make sure, Nancy, you're good? Okay, we can't hear you, but that's because you're muted. Okay, Nancy, we will unmute you, Nancy.
Can you unmute 6?
Everyone, just unmute
Well,
everyone.
these are just the call-ins, just to see what
Okay.
level she is.
Okay. Yeah, if you
Just-
can, Nancy, you should be unmuted now.
You gotta mute her.
Nancy, we're going to start. That's okay. I think Nancy is unmuted. I don't think so. Okay. Nancy, we're going to start. Hopefully, we'll be able to work this out. This is Dr. Cullen, accompanied by Nancy Johnson from El Rio, and we are convening the Road to Recovery Task Force. Today is June 19th, and I'm going to turn this over to Dr. Garcia to do the roll call.
Just really quickly going to do the roll call. I realize that some folks are having issues with muting and unmuting. I think everybody should be unmuted now. And I can see folks chatting. So Michael Abacasis, are you on?
I am here.
Iman Hakim, are you on? Paul Horowitz, are you on?
Yes.
Clint Kuntz, are you on?
Yes, I am.
Jonathan Leonard? Jonathan, are you on? Rose Lopez, are you on? Judy Rich, are you on? James Stover, are you on?
I am on. I do have to get off around noon, though. I apologize.
Okay. Chad Whelan, are you on?
I am on.
I just saw Iman Hakim, so I know that you are on. And Dr. Nancy Johnson, I see you too.
Great. Nancy, I think we heard you too. Okay. Thank you, Dr. Garcia. Now we will turn it over to the County Administrator, Mr. Chuck Huckleberry, who will give us a back-to-business update.
Yes, just very briefly, thank you and good morning. It's still morning. It won't be in about 15 minutes. I just want to tell you that the board will later today at 3 p.m. consider an ordinance or a proclamation of the county requiring face masks. What I believe your purpose is they would like to base that information and that action on scientific and medical evidence, and I believe that you're in the best position to provide that advice to them, and so I think we look forward to your advice on this matter. Thank you.
Thank you very much, County Administrator Huckleberry. Now we will turn it over to Dr. Francisco Garcia, the Deputy County Administrator for Health and Community Services, to give us an update on the Pima County pandemic situation.
I'm going to be sharing my screen, so you should be able to see the graphic here. And what I want you to pay attention to the fact is that just in the last week, we have more than tripled the number of total cases of COVID-19 than we have had in our previous peak back around Mother's Day. So this is obviously very concerning. At this point, what you can also see is that with regards to mortality, we still are experiencing very low mortality. But remember that mortality is going to lag behind. Dusty, I'm having a hard time with being able to move this document. I will show you a really sort of quick animation that shows you where the cases have been occurring and that ages them out that I think illustrates a really important point. And that is that, what you'll see is that we get a bunch of dots sort of filling in all over Pima County, that you get some of them starting to age out. But in recent times, and as the animation goes through, you'll see that we were starting to look better. This was about 3-4 weeks ago when we had kind of the lowest number. But what you're starting to see in the more recent weeks is that, again, just like at the very beginning, we're starting to fill up with new cases that aren't aging out. Thank you. So the other piece that I will share with you really briefly here, and all of this is in the materials that we sent you, is that as my friends in the hospital systems understand painfully well, that again, we had a peak of hospitalizations back on week 15, had been generally downgoing, have recently started to see important increases in hospitalizations. And in fact, today we have some sort of very concerning numbers. In terms of the number of deaths per week, again, we peaked back early on in week 15 and 16, have been steadily going down, but in the last week have started to, again, experience some significant mortality, all of which is extremely concerning for all of us. One of the things that has been of interest has been how that mortality is playing out in this community. About half of the decedents are, more than half of the decedents are men. The vast majority of decedents are over the age of 55, reflecting the fact that these are folks who have multiple underlying medical conditions. Most commonly, our decedents have had diabetes, serious heart conditions, renal failure, chronic lung disease, among other things. Really important in terms of the racial and ethnic makeup, at least at this time. The racial and ethnic makeup of decedents overrepresents white, non-Hispanic populations. And although that is changing with regards to cases, at least at this time, deaths are highest among that group. This is a really important graph that shows you two things. So in blue are the number of new infections. The blue part of the bar graph is the number of new infections. The gray part of the bar graph are the old infections that have graduated, essentially, that have recovered. So what I want you to pay attention to is, again, the blue infections had been going up. That is, the recent infections had been going up, peaked back on the 25th, but now we are, again, substantially in excess of that initial peak. And again, a very concerning kind of thing. One of the things that has been a question that has come up is, how is this playing out in different demographic groups? So again, on the x-axis, the MMWR week, we've put certain time highlights when the stay-at-home order came into place, when it was lifted, and Memorial Day. The different colors represent different age groups, and I want you to pay attention to one really super important fact, is that almost all the case growth has occurred among the 20 to 44-year-old age group. This is extremely important, and part of the reason why we are having this conversation today. Most of that case growth happened relatively shortly after lifting the stay-at-home order, and has exacerbated in the last 3 weeks. The other age group that still remains relatively small, but went from nothing to now representing over 70 cases per month, is the age group of 0 to 19. Whereas 4 weeks ago I was saying, no, we don't have any pediatric cases. That's just not the case. That case growth happens right at the end of the school year, ironically enough. With regards to race and ethnicity, again, now this is cases, not decedents. These aren't deaths. These are new infections. What you're seeing is that there is an increasing fraction of Hispanic, Hispanic or Latino as compared to non-Hispanic white that has occurred in recent days. The gender distribution remains about equal. I think this graph is really very telling. This is the number of cases by age group by month, and you again just see that what a tremendous increase we've had in the 20 to 44-year-olds, as well as a very significant increase in the 0 to 19-year-olds that were previously not at all an issue. Please note that we're reporting June data, even though we are still well in the middle of that month. And so we know that these numbers are going to get even worse. The last thing that I'm going to share with you is a really important graphic, and I will try to give you context for this. A lot of conversations have happened about where it is that this infection is playing out in this community, and those are fair conversations to have. The truth is that it is impacting every single corner of this of Pima County, but if we just look at the last 3 weeks worth of infections, because again, after a certain period of time, you're no longer infection, we do start seeing a centralization of some of those cases and in some parts of the county. So I think that's important, and it's certainly informing our strategy here in the county. I'm going to take questions from the audience. I'm going to take questions from the panel now before I turn it back to Dr. Cullen and Dr. Johnson. And if we have none.
Francisco?
Yes.
Dr. Garcia?
Yes.
When you look at that, this is Nancy Johnson. When you look at that geographic distribution that you just had up there, and we look at where we're seeing those greater number of cases, is that correlated at all to volume of testing done in certain census tracts?
So Nancy, that's a very excellent question, which is we have had in Pima County, we've been lucky enough to really be engaged with our federally qualified health center partners and others to expand the availability of testing in this community, and it does overlap to a certain extent with areas where we know, for instance, El Rio or United Community Health Center have, or Marana have really sort of stepped up to the plate. And overall for the state, that has been the case, right? But that's also not all the explanation in terms of the number, in terms of the amount of case growth, and I think we want to sort of be honest about that too. So yes, we are identifying more cases through testing, but there's also real case growth that is occurring above and beyond that.
Mm-hmm. Yeah. Well, I'd ask that question just when I look at, I think we've tested about 7,000 people so far, but when I had them run that data by zip code, I was seeing, just those heavy concentrations that kind of match up with your map as well.
Certainly. Any other comments from the group?
Hey, Dr. Garcia, this is James Stover. Can you hear me okay?
Yes, James.
Oh, great. The only thing that I would say as a comment is also from a health plan perspective. So even in the peak, we were seeing about an average census of about 5 to 7 individuals hospitalized for COVID on any given day. Right now, our census is running between 30 and 35. So just in the past 3 to 4 weeks, we've seen that definite spike. So, I mean, obviously there's a lot of data that shows that, but just from a Medicaid perspective, we've absolutely seen an increase in hospitalizations in our membership, the Medicaid membership related to COVID.
Good point, James. Any other comments from the members of the committee? I will turn this back to Dr. Cullen.
Thank you, Dr. Garcia. Dusty, do you do my slides, or how do I do this? You got them? Yay. Okay, we are now going to walk through science. What I've done in the past few weeks, as I'm sure many of you on the phone has paid attention to the publications, and I want you to be aware, as we know this is a changing arena, the number of publications that are coming out are dramatically increasing right now using PubMed, so predominantly peer-reviewed, though one of these articles is not peer-reviewed, and I'll point that out to you. We're seeing about 130 to 150 articles out there. I've curated these to be the ones that are significant and pertinent to our current situation. You can see this first article right here is from the National Academy of Sciences, was published this month. Almost all these have been published this month. And it really looks at what the wearing of face masks does. And you can see most effective means to prevent, obviously with the recognition that we need to pay attention to social distancing, quarantine or isolation when recommended, and contact tracing. So this is an endorsement for the role that the wearing of face masks can play in interhuman transmission. Next slide. The next article that is once again a peer-reviewed article was in The Lancet, and it looked at physical distancing, face masks, and eye protection. I did not pull out the individual graphs for each of those. Suffice it to say they are available in the article. And primarily, we've been focusing on physical distancing and face masks, and you can see that once again, these are considered to be 3 simple and common interventions. This article does point out the need to continue on the other scientific endeavors that the nation is doing, which is to discover and then implement pharmacological treatment and vaccines. Next slide. The next slide is from the nursing studies, and it looked at a rapid systemic review of face masks and respirators against coronaviruses. In this case, the respirators were N95s. However, what I've pulled out for you is the data that's related to the community use of masks, so not N95s, by people that are presumed well. You will remember there are asymptomatic as well as pre-symptomatic people that normally categorize as well in high transmission, such as household or college settings, which I think is very pertinent to Tucson right now. And what they found is significant benefit if used early, and obviously with hand hygiene, which we would say is a part of using masks, and if there was compliance with masks themselves. So this is mask use early with hand hygiene, either meaning soap and or hand sanitizer. Next slide. The next slide is a model study, and I think that what's important to note is that because we are fairly early still in the pandemic, the modeling has been done really using what we would call artificial intelligence and hypothetical mask adoption in certain communities where the data has been available. And you can see here that this hypothetical, once again it is hypothetical, near mask adoption in Washington and New York State suggests that immediate near universal, so in this case 80% adoption of moderately effective masks, you can think cloth masks for this case, could prevent anywhere between 17 and 45% of predicted deaths. Now this is very significant because this is the impact on mortality. At the same time, we do see an impact on morbidity in this same study. So once again, recognizing the tremendous impact of adoption of moderately effective masks, which is what we recommend for most people, on mortality. Next slide. This is the community use of face masks and COVID-19. This is a new article that just came out in Health Affairs. This is the article that is not peer-reviewed from a traditional medical perspective. Health Affairs is a journal that is used to help guide policy making, primarily at the federal level. However, this article was peer-reviewed prior to publication with Health Affairs. And what we see in this article is the natural experiment that has occurred in the U.S., meaning that in places where there have been state government mandates for face masks, 15 states plus DC, and you can see the time period there, April 8th to May 15th. What was the impact? And you see a decline in the COVID-19 growth rate. Once again, remember the incubation time period for COVID-19 is anywhere between 7 and 10 days, maybe 4 to 10 days. So the impact never occurs immediately, not tomorrow, but it should be seen fairly rapidly. And once again, the significant impact of this in terms of averting cases, 230,000 to 450,000 COVID-19 cases. So this is a retrospective look at what we know happened in these countries and what happened with their impact on the case number. So I offer for you the considerations from this science. There are other articles. However, they support these articles, which were curated to either be meta-analysis or articles that would show you different ways to evaluate the data. COVID-19 is a disease that continues to cause a large burden. We saw numbers today of increasing caseloads. We know that there's suffering that contributes and is a part of the disease itself once it occurs. Individuals, families, and society have been tremendously affected, including in Pima County. We also know that there are potentially effective interventions that can be available that can transmit the transmission of the SARS-CoV-2 virus. That is the virus that causes COVID-19. I think normally we just call the virus and the infection together COVID-19, but the virus itself is known SARS-CoV-2. Next slide. So because of this, we come to you with a recommendation for mandatory mask and face covering wearing in public spaces. You can see what's written here. Obviously, we recognize there will have to be some exemptions, so this is the larger macro recommendation. With that, what I'm going to do is turn this over to my co-chair, who is Nancy, and ask her to facilitate a conversation with the members of the panel, and hopefully we can come to a recommendation prior to leaving this meeting. So Nancy, I'm going to turn this over to you.
Thank you, Dr. Cullen. Can you hear me?
Yes, thank you.
Yes, great, thank you. So first of all, thank you, Mr. Huckleberry, as well as Dr. Garcia and Dr. Cullen. Those were really helpful to see the disease spread from the slides. And also, Terry, thank you so much for that great literature review of the emerging studies. So I think first is, what do questions people have who are on the call with us? I think one thing that Dr. Cullen brought up was the exemptions. You know, we've seen in this recommendation for individuals, this is for individuals greater than 2 years of age, but are there other exceptions that we need to talk about, or other populations, or just general feedback on this, please? And if it's really silent, I would call on Clint.
Oh, thanks. I have a feeling you do it.
Yeah.
I guess my question is this going to be universally rolled out to all places of business, places of worship? Is that going to be monitored inside those type of facilities? How will it be worded as a universal? I know it's public, but are we including public inside of businesses, places of house of worship, those type of things? Just trying to make sure that, you know, we all use consistent language and consistently talk about it as we push it out there. And then what type of criteria are we going to evaluate it on to roll back the recommendation at some point? You know, do we look at cases going down? I think we need to have that out as part of it, is what's being evaluated to look at taking that away as well.
Wow, yeah.
Dr.
Thoughts on
Garcia?
that?
So,
Dr. Garcia, what do you?
thank you, Nancy. A a couple of thoughts that are important before I turn it over to Dr. Horowitz, I think, who was trying to make a comment. So the language as we have entertained would sort of make this in places that are in the public sphere, right? So yes, it would apply to businesses and houses of worship and other places where the public congregates. It does not apply to people's individual home or individual dwelling, and it would not apply to jails or prison and other settings. The idea being that it applies to individuals who are able to comply. So there may be some individuals for whom physically putting on a mask may not be a possibility because of physical disability. There may be some individuals for whom mask wearing, for instance, if you are deaf and you need to read people's lips and you need people to read your lips, that may not be appropriate. I think we envision that there are a variety of sort of medical kinds of exemptions. We've come up with a list, but certainly want to hear if there are other things that you have in mind. I'll turn it back to you, Dr. Johnson.
Yeah. Other thoughts you had, Clint, before we ask someone else? Did you have other thoughts about exceptions?
No, not really. I think the fewer exceptions and cleaner we can keep it, the better. Obviously, it's more effective. It's easier for people to understand. We've had universal precautions at all of our sites and health centers for quite a while now. One thing we've noticed is quite a bit of public pushback on that. I don't know that we're on how we help businesses who are going to get that pushback and deal with these public people, because we don't want them calling the police. We don't want that type of enforcement mechanism. That when you have people pushing back and saying, well, I'm not wearing a mask. I mean, how do we empower businesses, or maybe we can give them some talking points on how to handle upset customers, patients, whoever they're dealing with at the time?
Thank you, Clint. Other feedback? Other folks on the call?
This is Dr. Horowitz. I really like the work the committee is doing. I think this is simple and effective, not cost. You go into a restaurant, no shirt, no shoes, no service. I mean, there's not this would be an effective means. Which metric you use to follow the success of this should be discussed. Obviously, the number of new cases are going to go up, and we talked about last time contact tracing is of benefit, but of limited benefit because of how rapid this transgresses and how long it takes us to get the labs back. But I mean, this seems like this is a no-brainer, and it's just how to enforce it and how to get the public on board with it, because I kind of find, and generally the public seems to, someone takes a position, someone takes a position, they take a position and then they argue to it. And I really like this committee because it's based on science. And I think, Dr. Cullen presented evidence that this is effective, and there's no reason not to do it. There's a lot of reasons to do it. So it's just how you implement it and how you measure it.
Yeah. Thank you, Dr. Horowitz. Others?
Nancy, this is Chad Whalen. I just want to say the previous thoughts. I think the science supports it, their own observational experience supports it. And I also want to really focusing the exceptions on the medical, because I think that just keeps it clean. And if you can come up with some concrete examples, that's great. It certainly won't capture everything on the first phase, but that feels very clean, and I strongly support that.
Thank you. At our health centers, we've not had much pushback at all. In fact, and obviously if people arrive without a mask, we're giving them a mask. People have been relatively grateful and thankful. I think we've only had maybe one or two reported situations, and they were both patients with serious mental illness as well. So, we haven't had that experience yet. And then I've noticed in places of business already that many business proprietors, owners have been handing out masks to customers or clients coming in to their businesses as well. So I think the more straightforward it is, the better off as well. Other feedback? Thank you, Chad. Who else haven't we heard from? We haven't heard from Jonathan. I think he was on the line. I was trying to get through. Who else is on the call here? Let's see. Jonathan, anything to add from Ajo? What's going on out in Ajo?
Well, we have had a very interesting experience over the last. The number of cases continue to rise here locally. So for us, it's mainly about what is the implementation going to look like, what's the messaging going to be, so that we can communicate to our business partners so that it doesn't create just one singular message that everyone can champion. And I think as time goes along, I know that what we've seen in our community is that as people are donning their masks, and more people see that, and more people start to engage. So I'm interested to see how this all unfolds.
Okay. Other comments from the group? What I was hearing is that we're supportive of this. We don't want to really identify exceptions to it, but obviously if people present with medical exception, that would be honored, but we wouldn't want to put that in our recommendation to the Board of Supervisors. Is that right?
Yeah,
Hear
Nancy,
somebody a little bit. Who's talking?
this was Terry talking, but Iman had her hand up, so I think I'll defer to her, and then we can go back.
Yeah. Thank you.
Yeah, hi. So this is Iman from the College of Public Health. You might have a more compliant audience there. So we actually agree, and we have added to all of the syllabi that students will not be in the classroom. So it's added already to the syllabi without a mask. And within the university and as well as the college, so we mandate mask in all of the interior. We might go even to the extreme that regardless of the 6 feet, if it is an open cubicle, and we are working on a different work shift. But also our exposure scientists were looking, and that's addressed if there is an exception, then addressing the effectiveness of this clear mask that has been circulated. And this might address the idea, I don't know, maybe people in speech therapy, if it will be helpful for those who want to express and so forth. And right now there is some study on the effectiveness of the clear mask as compared to the cloth mask, and we should be having the results soon. So that might help to alleviate some of the exception, because now they can wear them and they can express themselves if needed.
Mm-hmm. Oh, thank you for sharing that.
County Administrator Huckleberry, did you have a comment?
Hi.
Other feedback?
Yeah, it's Paul Horwitz
Yeah.
again. I appreciate what Nancy said. The simpler it is for the Board of Supervisors, probably the better. I just wonder if they're going to bring up, what do you do when you go into a restaurant and you're going to eat? But I guess then if there's social distancing, you would allow them to remove the mask to eat. But I think that it's important, and I think at some point we probably need to discuss, besides easing measures, what we do if things get worse and we need to be more restrictive on measures.
Yeah.
Nancy, the county administrator is going to comment.
Other comments from the group? Okay.
Nancy?
Dr. Cullen, is there anything that you or Dr. Garcia want to add to the discussion?
Yes, the county administrator is going to make a comment first.
Yes, thank you. What I would like to do is just ask a question, because I've gotten feedback from 2 board members, from the moms who are calling in.
I don't think we have any additional comments. And I can't hear you if any of you are talking right now. I heard Paul perfectly well.
Okay. Nancy, can you hear me? This is Chuck Huckleberry.
Hi, Chuck. I can hear you. Was that Judy?
Yes, that was Judy. I'm sorry.
Prior to that, okay, sorry, Mr. Huckleberry. Judy?
I just wanted to say I'm fully supportive of the record.
Thank you. Okay. Back to Mr. Huckleberry. What were you about to say?
Yes, I think we would like a little bit of advice on one small item, but it's some feedback that I've already gotten from 2 board members related to calls that they've been receiving from moms in the community. And that's the issue of 2 years old. And we know that that is CDC guidance, but I would think that they might feel a little more comfortable at 5 years of age. So I think the question to you is, does it make that much difference between 2 and 5? Or again, it's the issue of, sounds like we've already had some community feedback that 2 may be a little too young.
Yeah, thank you. So back to Dr. Garcia's slides, my notes to myself were obviously about that surge in cases from 20 to 44, but also the uptick in 0 to 19. My follow-up question would have been, what's the distribution among 0 to 19, which is a broad spread? Is it happening in the school-age population, the young teen population? Is there a distribution along, what's it look like from 0 to 5?
That's a terrific question, Dr. Johnson. So when we look at the 0 to 19 age group in particular, the vast majority of the cases are in the latter portion of that demographic. So we're talking about kids who are teenagers and older that are the new cases. Yes, there have been a few cases in neonates and little teeny ones, but those are still relatively few and far between. The vast majority of the growth has been in the teens and pre-adults.
Mm-hmm. Thank you. So what's the group think about that based on feedback from our community around 0 to 5? So it would be for individuals greater than 5 years of age.
So this is Chad. Are you able to hear me okay?
Yes.
I absolutely understand the difficulty of trying to mask a 3 or 4-year-old having a 5-year-old myself. But, I guess I would say if we are going to move it up to 5, I would favor that saying, although in the exception of if you are in a child care or school setting where you're having large groups of people interacting, you might not have the exemption at that point.
Yeah. Then we start layering on exceptions once we deviate from CDC guidance. That's been part of our decision making, is trying to stay in alignment with the health department and with CDC and our guidance.
Yeah, so let me just...
Yeah, okay, go ahead.
Yeah, let me emphasize. My gut would be to say keep it at 2. But if we're going to move it to 5, I would prefer keep it at 2. But if we move it to 5, at least have the protection of having in the larger group settings.
Mm-hmm.
This is Dr. Horwitz. I just think the consistency is one of the most important aspects of this. So I'd be more in favor of going along with the CDC, and I don't know what the city of Tucson did. I think if we make it at 5, it's going to be more difficult to move that bar back to 2, whereas if you make it at 2, I guess, it could always be revisited if it became a problem. But I just think the more we're consistent with CDC guidelines and the rest of the community, the better. That's my thing.
Mm-hmm. Yeah.
Nancy, Dr. Garcia had a comment. Did you?
Yeah.
No.
I think I prefer to stay at 2. I have grandkids who are at 4 years old. They perfectly wear the mask. We give them a pediatric mask, and so they have it. They even interact with each other as cousins with the 6 feet and the mask, and it's been a while, and they are working really fine, and they know their limits. So I think it is doable. And they have been wearing it. They are 4 years old, so they are wearing it, and they put it to themselves. Very small, and for Amazon.
Amazon.
Yeah, you get pediatric masks. Yeah.
Other feedback? Dr. Garcia, did you have something you wanted to say?
No, it sounds like the vast majority of the comments are sort of leaning toward the 2-year-old to be consistent with the CDC language. One thing that I would offer is that remember that nobody's. I think that parents need to make a reasonable effort. All of us who. Heck, I have a hard time making my 14-year-old do things that I need him to do. So we all know that there are challenges when we are dealing with children, and I think that the spirit here is to be as science-driven, certainly, as we can be, but also to be relatively realistic. And I certainly wouldn't hold it against any parent who couldn't keep a mask on a screaming 3-year-old.
Yeah, agree.
Nancy,
Okay,
this is,
so, go ahead, Terry.
this is Terry. Well, I just want to echo, I think there is a value in being consistent. CDC is at 2. The vast majority of other people that have done this have started at 2, really because of the consistency with CDC. The other thing, there was a comment about how do we roll back, which I think was a really important question. I actually don't know the answer to that right now, but if we are adhering to some national guidance, it will give us more opportunity to roll back if and when CDC changes their guidance. I will say when CDC has previously changed their guidance, like in contact tracing, we then adopt the CDC guidance. So it does give us that flexibility to stay consistent with federal published guidance.
Yeah, and I think today we make note of Clint's comment about how would we roll that back? What would that look like? We'd be looking for the evidence and the data to, give us some indications or criteria and look to the studies that have been done other places. So good question, Clint, and Terry made note of that because I don't think we'll have thoughts about that today. Other feedback from anybody else? It sounds like we want to stay with these recommendations that Terry had prepared on her final slide. And I've heard from Clint and Chad. I think James got off the call. Iman, Paul, Jonathan, Judy. Anybody else need to weigh in support or not in support of kind of the conclusion we're reaching here? Okay. All right. I think we've done our work. This would be our recommendation that we would make to the Board of Supervisors for the 3 p.m. meeting today. Is that correct? Yes? Okay.
Yes.
Is there additional work we need to do today?
Nancy,
Are we good?
I don't think so unless there's additional work. Unless there's anything else from the committee, we will make sure that we captured the additional things that will need some work in the future. But for today, it sounds like there is, I think I'll use the word unanimous recommendation from the people that are present that we move ahead with the recommendation as written, with the acknowledgement that there will be exceptions and that those will be developed and proposed to the board this afternoon. I think that that's accurate. If there aren't any other further questions or comments, I guess I would love to dearly thank you for your participation and your willingness to help us work through some very difficult and yet critical issues. Nancy, do you want to say anything before we adjourn?
Yeah, just to echo your thanks, Terry, and also great appreciation for all of you at the county for helping us, for supporting us in our care and outreach for the community. And I really appreciate the slides that you've put together and being able to share those, with my colleagues here and other teams. So thank you all very, very much.
Great.
Have a safe weekend, I think, and we'll adjourn.
Okay. Thank you. So we are adjourned.
Thank you.
Thank you, everyone.